You're live now. So you're live now.
Thank you, Andrea. Okay, Chairman, we're ready to start the meeting.
Good morning, everybody. Good morning. Nice to see all these shiny, smiling faces. No comment. They're saying, what's he on about, shiny, smiling faces? As I said before, welcome to the July meeting of Adult Social Care and Communities. I think we'll see if we have any apologies for absence. Do we have any apologies, Joe?
We have one apology, and I'm just going to say I'm sure it's an apology from Councillor Alistair Chambers. That's the only apology I have.
Okay, thank you. Does anybody wish to declare an interest which they already haven't declared on their return? Okay, thank you. Now we come on to the minutes of the meetings held firstly on the 26th of January 2021 and the 9th of March 2021. Were those members who were at those meetings wish to propose the approval of the minutes? Thank you, Steve.
Thank you.
And Terry, thank you.
Duly noted. Thank you, Chairman.
Thank you very much. Thank you. And we now come on to, quite quickly, number 4, the Public Health Report by Professor Sarah Scott, Visiting Professor of Public Health at UWE.
Thanks, Chair. Good morning, everybody. So before you have a report from my team, my public health team and I about public health. And because we hadn't properly got into our stride with the agenda planning, what we've done for this report, to give you an overview, if you like, of the key public health issues that have come under the spotlight due to COVID. So that's in the report. What I'm going to do first, though, is just talk you through some of the COVID data, because clearly this is still highly topical for us at the moment. And then I'll just talk you through a quick summary of the public health report, and I'm happy to take any questions. So thanks, Joe. I think it's probably slide 3 with the summary slide on this. You just skip forward. That's it. This is it. So you would have seen on the news. Oh, I think we've lost there. I'll carry on talking while Joe gets the presentation back. So you will see on the news that our rates have gone up and are going up across the county, across the country. And the slide that will come up in a minute is a summary slide, and what it does, it shows you our rate across the county and it shows you our rate across the districts. And we've seen an increase across all of our districts. I've been asked many questions about this, as you can imagine. I've done lots of media interviews. Now, we're aware of every positive case in the county. We work very closely with the National Test and Trace Service and with Public Health England regionally. So what we're seeing is general transmission in our communities. So it's out there. The Delta variant is much more easy to catch. And what we're seeing then is we're seeing much higher rates in the unvaccinated, so those that can't or haven't yet had a single vaccination, or those that haven't yet had their double dose and then the time to mount an immune response. So we're seeing very few cases in the vaccinated population, which is great, because that's clearly indicating the vaccination programme is doing what it's designed to do. It's designed to prevent death and serious illness resulting in hospitalisation. So now we've got the slide back up. So I'll rate there, and there's always a gap because we leave about 5 days to make sure that we're getting all the case numbers through and the data is accurate. So we would have a 5-day lag. So this data was pulled off first thing yesterday. So our rate is 218.8 per 100,000, which clearly is much higher than where we were sort of around 6 weeks ago. And that's in the top middle red box. If we just draw your attention to the district data down below, you can see there's a real spread in terms of prevalence across our districts, with highest levels in Cheltenham, Tewkesbury and Gloucester. I think also it's quite easy to get fixated on a particular district having higher rates than another, and I've seen across the last 17 months all 6 districts being at the top of the list in terms of having the highest prevalence. I think what I'd also say, particularly about Cheltenham, Tewkesbury and Gloucester, is that the boundaries are permeable, so people travel across them to go to work, to go to school, to socialise increasingly. So I'm not surprised that rates are ebbing and flowing across the districts. So you would have seen in the news as well some concern about the number of children that are often self-isolating. I think we've got over 200 positive cases in our schools at the moment. And the reason why we have a relatively high number of children self-isolating is because all our schools differ. We've got tiny village primary schools and huge secondary schools with thousands of children and young people in them. So how they choose to bubble their children and create COVID safe spaces varies because all the schools are different. And the schools have done an amazing job in the last year of trying to keep the children and their teaching staff safe. Yeah. But that's why we're seeing different approaches. And also because we're a rural county, we rely a lot on school transport. So if you have a positive case and the child gets the bus to school, then you've got to consider the children on the bus as well as the children in their bubble at school. So I've answered lots of questions in the last week about the number of children self-isolating, and I think my answer is always the same. I think schools are doing a great job. They've got plenty of advice and support from my team and the safety and health team in the county council, as well as the Department for Education helpline. And we're just trying to get them through to the end of the school year. I think everyone deserves a rest. And what we're also seeing, I think it's important to note, is the peak of the cases are in those 20 to 24 age groups. So we were seeing quite a lot in 15 to 19s, but those children aged 15 to 16, more or less, at the year 11 have mostly left now, having done their GCSEs. So we should start to see a slight decrease in the number of cases in school-aged children going forward. So other thing to point out is good news is that we've not had a death in the last week. We are now sadly up to 1,100 members of our community that we have lost during the course of COVID. But the numbers of deaths have significantly slowed down, which again is further indication that the COVID vaccination programme is doing what it's designed to do. Let's have a look at the next slide, please, Jo. Staying up today, isn't it? Sorry, I can't remember what the next one is. I can't do it from memory.
COVID-19 cases, Gloucestershire residents.
Oh, okay. So I can't remember the exact detail of this slide. Sorry, so I can carry on talking. Right.
No.
I'll tell you, I'll talk from my papers. That would be easier. And then if you've got your papers, just bear with me a second. Sorry. And I'll pull that up. I should have.
I think we're there now, Sarah.
Are we? Okay. I'm coming back, switching screens. Okay. So this talks about our cases in our residents, and you can see there at the bottom, our case rate in the 0 to 19s is high, as is that in the 20 to 39, but see it's much lower at the older you get, which is good, and that's not the pattern we saw at the beginning of the pandemic. And you can see there at the bottom right hand side the case rate per 100,000 population by the districts, and again it's another way of displaying the data on the previous slide. If we can go on to the next slide, please, Jo. So we get data in a variety of different forms from the national data set, and one is on a geographical basis called a medium super output area. So there are 75, or medium or middle super output area. There are 75 of these in the county, containing around 7,500 to 8,000 people. And they're bigger than a ward or a county council division, but smaller than a district. And you can see some of them are quite large, but based on some of our rural geography. Basically, the darker the colour on this map, the higher the prevalence of COVID. So you can see there some darker colours around the Gloucester, Cheltenham and Tewkesbury areas. I would also draw your attention to the sort of the semicircular dial on the top right-hand corner. The average age of our patients, our cases now is 26.2. I mean, back at the beginning when we first had this dashboard, it was well into the mid to late 40s. So we're definitely seeing a different pattern in terms of how COVID is affecting our population. Next slide, please, Jo. And this is a slide looking at our deaths. So in the pie chart and on the graph, the deaths in the community include those in care homes as well as those living in their own homes, and the blue are those deaths in hospital. So you can see there in the first wave, we lost more people in the community, and that pattern changed quite a lot over the second wave there. And thankfully, as you move on to current day, you can see very few deaths from COVID, which clearly is good news. Next slide, please, Jo. And this is just comparing us to our neighbours. We've seen all sorts of different patterns as COVID has moved through the country throughout the pandemic. So Listed on here are our geographical neighbours, and we've got 7 different local authorities bordering our county, as well as our statistical neighbours as well. So Gloucestershire is in the middle, and we've sat at the bottom of this list for quite a long time. In the southwest, we tend to see Bristol tends to have some of the higher rates, partly to do with some of the demographic mix of the population, the amount of mixing that goes on and commuting in and out. So we can see there that our rate is slightly under that of England now, which is a very recent change, but above that of the southwest. Next slide, please, Jo. And that's the end of the presentation. I'm quite happy to take some questions on COVID, or I can, if there are any questions, Chair, I can go through my public health report.
Does anybody wish to ask Sarah any questions?
Am I still on?
Yes.
Oh, no, I just say, Sarah, thank you so much again. It must be hard work. You do 24/7 a day with all your graphs. How many have you got in your team?
I have to admit, Pam, I've got an absolutely amazing team. The public health team have been just completely brilliant throughout this. I don't do the graphs myself. So, and also we rely on the analysts in GCC. And I think that we invested in some of the COVID money in a new, what we call a dashboard that helps us produce these reports, which I think are more helpful and visually appealing for not only colleagues who are using them to inform their service planning, but also when we share them with colleagues like yourself. So no, I've got a great team, and we've had some non-recurrent COVID money that's helped us recruit some additional staff. Without that, we would have really struggled.
Well done. Don't you agree, Chair?
I do indeed, yes. I think it's
I'll pass on your thanks.
incredible designs.
I'm trying to mute myself here, but
And they're so simple to understand.
I think Mark would like to ask a question, Chairman.
Mark.
Kenzie.
Thank you. Do you have a breakdown of the sort of age range of those people who have recently become infected? Because we read and hear on the television news that it's very much the younger generation. I'm sure that the more that, if that is the case, it will instill greater confidence in, if I could say, our average age group, possibly to get out and get back to normal.
So yes, we do have that, and we showed you just a graph in that last pack. I think what we're doing is we're producing a new set of graphs in relation to the age ranges for the future packs, because I think it's helpful to see them broken down by almost 10-year age groups that mirror the age groups in the vaccination programme, so it's easier to see.
Is that not two and three? It's 3, isn't it?
Yeah, there is a graph on there already. It's in like a teal and pink colour to show the age breakdown, the gender breakdown as well. But we're going to show it and the 10-year age groups that mirror the vaccination cohorts as well, so you can see. I think we are definitely seeing higher rates in the 20 to 24 age group. That they are much higher than the rest of the age bracket, and that's partly because they're the group that we're just inviting them for vaccination. We're seeing a really good response, but we need to make sure that we're encouraging them to come forward. And also, it's a balance between giving the older age groups some comfort, some reassurance that the vaccination programme is working, versus not stigmatising or blaming those younger age groups that either haven't had the opportunity to have the vaccination yet, and certainly most of them they haven't had the opportunity to be fully vaccinated. And we obviously want to then encourage them to keep on adhering to the rules for as long as possible. So it's a balance to be struck. So in all my communications, I talk about, we know we're seeing higher rates in the younger age groups, and it's not just about whether they've been vaccinated or not. You tend to find that younger people are employed in more public-facing, low-paid work, and they tend to, in the hospitality or leisure industry, which of course we've had some of our freedom back, haven't we? People are going out and about a bit more. So not only are these age groups probably enjoying some of that, they're also working in those industries as well. So it's a double whammy, if you like. So it's not surprising we're seeing an increase in this age group, but we just have to be mindful in terms of how we encourage them to come forward and get the vaccination when they're invited.
I'm sure that if that information is published in whatever way possible, it will sort of ram the message home for those unbelievers in this, and it'll encourage them to get out and not to try and tough it out with to their peer group and say we don't need it, we're young and fit. I think it's a very powerful message.
And when we're doing quite a lot of bespoke communications with that age group, using social media, using peers and sort of what we call social influencers, to try and influence their behaviour. I think to date we've not picked up a great deal of hesitancy. I think it's just about making sure that we make getting a vaccination as easy as possible. And because of the nature of some of their employment, it means that some of the vaccination times aren't as easy. So we're doing more drop-ins for them. We're trying to make drop-ins in more convenient places. So, and I'm working very closely with obviously NHS colleagues to do that. I think Tim's indicating, Chair.
Yes, Tim's either indicating or imitating a windscreen wiper.
No, my windscreen wiper impression is different to that, but thank you. Just a couple of points. Sarah might comment. I mean, I think as regards take-up for young people, we've been quite impressed by the take-up. I remember a discussion some months ago that we thought that as we came down the age ranges in terms of vaccination, we would get more resistance. And in fact, I think that's not the case, Sarah. Would you like to comment?
I'm not sure we're getting resistance. I think it's about trying to make it as easy for them as possible. So a lot of our younger people do not work in a 9 to 5 fashion. They might work evenings or weekends. So we have to make sure that we are making it as easy as possible for people to get vaccinations. And I think obviously when we're offering the vaccination to the older age group, we were offering it to people that maybe were retired, who've been self-isolating or maybe shielding, so had a bit more time and flexibility to attend an appointment when it was given. So that's what we're working through. It was to be expected. We're prepared for it, but we just have to keep on with the messaging. And certainly we're trying all sorts of different avenues to try and promote that, and avenues that perhaps wouldn't be immediately obvious to us because we're not in the 25 or 18 to 25 age bracket, if that makes sense. So some of the social media stuff is being targeted.
Kate?
I think there was also Terry was waving as well.
Kate and Terry. Yeah. Kate first.
Thank you. Last weekend, not the one we just had, the one before that, apparently there was a session here in Tewkesbury where no appointment was needed at all. One of my constituents asked me, because they said they would have gone if they'd known, and I would have told them if I'd known as well. So is there any way we can make the comms a little bit better? Because I've got quite good networks now and I can let quite a lot of people know, but nobody told me, and I thought that was quite strange because we get such brilliant information normally.
We don't arrange any of the vaccination programmes. It's an NHS programme. We're just supporting them. I wasn't aware of a drop-in Tewkesbury. I know there was one last Friday in Rosebank, and a week last Saturday in Gloucester, and we've had some in Cheltenham. I wasn't aware there was one in Tewkesbury, sorry. But I can't profess to know everything about the vaccination programme, to be perfectly honest. We were aware, we did push out the comms, so I can ask that where we have vaccination drop-ins that the local members are advised, we can certainly take that as an action, can't we, Jo? And
that would be super. Thank you. That would be great. Thanks very much. And I appreciate you. I mean, as I say, I know you do so much anyway. It wasn't a criticism that you didn't let us know. It's just I wondered if you would have a contact that could let you know to let us know, sort of thing. Yeah.
We can absolutely ask the question, and I think as we get down to the last several thousand, using every communication channel we've got becomes even more important, doesn't it? Because it might be seeing the parents of the young people who can then have a conversation with the young people, say, actually, if you just nipped over there 10 minutes down the road, there's a drop-in tomorrow. It's really easy. Go and get your vaccination. So I think it's a really good point. So we can raise that with the CCG.
Terry.
Sarah, you mentioned Cheltenham, Tewkesbury, Gloucester as high rates. Is there any specific communities that's developed from, and is that connected with non-vaccination? That community does it relate to that? I'm being as kind as I can.
So we have outbreaks in schools, we've got outbreaks in workplaces, we've got outbreaks in what we call leisure hospitality locations. There are single isolated cases in some care homes, again, mainly in people that are double vaccinated. So I suspect because of where we're seeing most cases in that 15 to 24 age group, more the 20 to 24 age group now. We're assuming, because looking at the vaccination data, it's because those people have not yet had the opportunity to have a vaccination. We're not picking up a huge amount of anti-vaxxer pushback. There are obviously people in the county that do not believe in vaccinations. That is absolutely their right. My advice all along has been, if you're unsure about whether to get the vaccination, do your research, but go to the proper sources to get the right information. Don't rely on social media. The NHS website, we've got lots of information about it. The CCG website, I think we've got some links on our website. But get the right information and just make an informed choice. So I think we need to, that's why we need to make sure that, relating to Kate's point about really making it as easy as possible for those people who have yet to get a vaccination, and you need both doses, that's really important, making it as easy as possible for people to get to those appointments.
Would it make it easier if it was compulsory to have an injection? Surely that would be that. I know some people can't and some people can, but you know, the reluctance to, we could be going on like this round in circles for quite some time, couldn't we, if we don't get everybody vaccinated?
I think we're doing really well. We're one of the best performing systems in the southwest in Gloucestershire in terms of uptake. I think all our knowledge about screening immunisation programmes from the last 30 years tells us it's far better to encourage people to come forward for screening and vaccination and those preventative healthcare services than to force people. So we've obviously had the news that there'll be mandatory care home vaccinations for care home staff going forward, I think suggested from October. And so we need to really think through how the implications of that, and that will have, you know, we're assuming that will have some implications on the care sector and staffing. But in our experience in public health, it's better to use the carrot rather than the stick. So in the meantime, we're going to do all we can to encourage people to come forward, particularly in the care sector. Some of it is about addressing some of their specific concerns, and we've done quite a lot of work to try and understand, well, why aren't people having the jab, particularly in care. And a lot of it is to do with the age group of the younger women concerned about fertility and the impact on fertility. And whilst we think we've done quite a lot to address that, we clearly haven't done enough. So we're working with health colleagues to make sure they've got the right information. There's lots of national resources now to try and address some of that and to try and answer people's concerns.
Yeah, good. That's you know, that's what I wanted to hear. We are trying to educate, and that's fantastic. Thank you, Sarah.
We are dealing with people's really deep-seated perceptions and fears, aren't we? And it's always difficult to try and get over those long-established views.
And we won't convince 100% of the population, and that's why we have this principle of herd immunity, where you need to vaccinate a large proportion to protect those that can't or won't have a vaccination. And that's been the same with every vaccination programme we've had. But Terry's absolutely right. We need to do all we can to make sure people have the right information to make an informed choice.
Yeah.
Thank you.
Thank you. I think Lisa has raised a hand. Can I just remind members that at the bottom of your screen, you have a symbol, a smiley face symbol. If you want to ask a question, you can just tap on there and just raise your hand symbol. Lisa, did you want to ask a question?
I just had a quick comment to make on Kate's point about telling people about vaccination centres. I've taken Cotswold District Council. We had an open weekend at Cirencester Hospital, and the council comms put out quite a lot of stuff on the council's Facebook and Instagram feed, which actually I didn't know about it, Kate, either until I picked it up on social media. So it is, as you say, Sarah, you know, just really pushing that as we're getting down to these last, well, we're not at the last yet, but you know, that widespread spreading is really, really good and really useful, especially when there are, you know, drop-in weekends and things. It's fantastic. So,
do you know how many people turned up, Lisa?
I don't actually. I haven't sort of asked or had any feedback on that. So yeah.
Okay, thank you. Do we have any more questions? Thanks very much indeed.
No more questions.
Can we proceed then to item number 5, the Adult Social Care Report?
Did you just want me to see if there are any questions on the public health report? Because there's a public health report as well that talks about the key issues that we think have arisen during COVID, so health inequalities, suicide prevention, weight management.
Good. Yep.
Can we just spend a couple of minutes just taking people through it, and then we can got time. So we obviously we didn't have enough time to write a report based on what you asked for in terms of agenda planning at the end of the induction session, because we had to have the reports in 2 days later. So what we did, we talked as a team about what we felt would be helpful for you to know, and then we can take a steer from you about what you'd like to scrutinise going forward. So the report, the public health update, talks about some of the main issues that have come to the fore or been in the spotlight, I suppose, during COVID. So we talk about inequalities, and I mentioned this in the induction session a couple of weeks ago, but inequalities and tackling inequalities drives everything we do in public health and is central to the work of the Health and Wellbeing Board. And it talks there about the work that we're doing and how the importance of working across not just the county council, but across the whole system, and certainly with the integrated care system and the new NHS structure that's coming into being. The report also spends some time looking at mental health, and I think this is where there is an overlap between our scrutiny committee and HOSC. So my team in public health do what we call public mental health. So it's not the treatment end of mental ill health. It's more around how do we maintain good levels of mental well-being? How do we keep ourselves mentally healthy? And we also lead on suicide prevention. So the report talks through what we did during the pandemic, the extra services we commissioned, how we are then now trying to work across the system, particularly with health colleagues, around understanding, well, what additional needs have come to the fore during the pandemic? How can we best tailor our services to meet that? And without a shadow of a doubt, there is increased need in terms of mental health and well-being across the system, whether that be in adults or children. It also talks largely about suicide prevention and our role in that, around some of the work we're doing around the suicide audit to learn from all those deaths by suicide, and that then informs our strategy and action plan for the next 3 years. It also talks about our real-time surveillance of death by suicide as well. And it's important to note that national surveillance data on suspected suicide, because it can only be a suicide once it's deemed to be a death by suicide by the coroner, to the pandemic, doesn't suggest there's been a rise in suspected suicides during the first lockdown. But it's very early days in relation to these figures. And I think suicide is obviously one very tragic end of the spectrum in terms of mental distress, but there are lots of other issues in between that and feeling mentally healthy. So huge numbers of issues around social isolation, self-harm, depression, anxiety, and also I think some post-traumatic stress disorder we woven into that in terms of what people have encountered during the pandemic. So I think it might be something you might want to come back to at some point, but we wanted to just give you a flavour of the work that's already going on. We then talk about domestic abuse, and we've been very active in the area of domestic abuse for the as long as I can remember. I've been here 8 years. But then talking about the new Domestic Abuse Act and what we're doing to support the new statutory duties for the County Council in relation to that Act. And there's a paper going to Cabinet shortly around, particularly one of the requirements is around safe accommodation, and there's a description there about the range of different types of safe accommodation we're commissioning. And an update on the on our implementation. Something also on rough sleeping. We also had the Get Everybody In programme during the first lockdown, and about how do we then continue to support these individuals who are rough sleeping and perhaps didn't fare so well in a hotel environment, and how can we make sure that our services are as helpful as possible. A quick update about weight management, because we recognise that actually a lot of lockdown and certainly I found just sitting all day, I've become more sedentary. We have seen an issue with maintaining a healthy weight during the pandemic, and we've got some early data that indicates that we might be seeing a bit of an issue in our children, but that data is not a full data set yet. So we are just thinking that through. It also talks about some of the services we've already got in place to tackle weight issues and promote a healthy weight. And I'll stop there because that's an overview of what we've brought to you, but I'm very happy to take any questions.
Sarah, Sarah, that was a great report. I wonder why we jumped from 4 to 5. No, and I'm going backwards here, especially with the children. And we all got to, learn to sit up straight. You're absolutely right, because they're probably sat playing up round shoulders, television, doing their work. perhaps we ought to come up with a design of a chair or something later on for children in schools. But you're absolutely right with the posture and everything. So we've got to concentrate more on PE or something, you know, physical education. Not only that, just us, especially in the homes as well. Going back to the travellers, we have got quite a few travellers here, but I think they know all what's going on. But we might have a few travellers coming in and out. How does one keep an eye on them? How do we know they all have not had injections? When sometimes I know they take their own doctors around with them, and I know they take a barrister sometimes with them. But how do we keep an eye on them from when they go from one place to? Because Gloucester's renowned for them coming in and out. They'll be coming in soon for the bank holiday again. How do we keep an eye on them all?
So we have a traveller liaison service in the county council that has really good links with some of the more resident traveller communities in the county. We also went to Stowe Horse Fair in May, and we did quite a lot of work. So we had a mobile testing unit. We gave out nearly 1,000 boxes of tests, and each box has 7 tests in, like 972 boxes. I'm not quite sure why it was such an odd number, but we certainly gave them out and had lots of conversations with the travellers that came from all over the country. And clearly we didn't talk to everybody, but there was a really strong sense that they understood the risk from COVID. A lot of the people that my team spoke to had already had both jabs. And sort of a real commitment to understanding they don't want to be sick. They're actually quite fearful of being ill. I think, like most of us, we desperately don't want to have COVID, do we? So we don't keep an eye on them as such. I think that there have been some specific communications that have come out, and we've used them to a degree from Department of Health around how to promote the vaccination. We've not had any cases that I can recall. That's reliant on my memory in terms of cases in the traveller population at all, and equally we've not really experienced any resistance. So I'm not quite sure there is a problem to be managed as such, but I think it's about making sure that we're making our information as available as possible and encouraging everyone to come forward. And making sure that information is relevant to all of our population groups. And the work we've got around the inequality, it's called the Vaccine Equity Group, also includes some of our groups that are less likely to come forward for vaccinations, and travellers would be within the scope of their work. So there is some work going on.
Well done. I didn't know about the horse fair. That wasn't. I didn't know. I couldn't go to horse fair. I ate it, their animals. I keep an eye on it.
Okay, Pam, thank you.
Going back to
Okay, we've got questions in this order from Councillor Steve Robinson, Mark Mackenzie, and then Lisa. So Steve first. Do you want to ask a question, Steve?
Yeah, thank you, Sarah, for your report, and that's really interesting. I think you're doing so much positive, you know, with the fair up in May and all this sort of work. First of all, I went my internet went down, so I didn't quite catch what you were saying about the abuse, but domestic abuse. I'll take that up in a second. But first of all, young people, and we all know that, you know, particularly those who've been off school and haven't seen their friends and suffering from anxiety, depression, etc. And I see that in your report you said about, which is interesting, that you're doing some social scribing for young people. I just wondered what that included and how you were pushing that out.
We're working with the CCG to design that. So I think some of you might be aware that social prescribing has been a really successful intervention that's been driven through GPs in primary care. And the idea being that not every person that comes into a GP practice needs a medical or clinical solution. Some of the broader issues around depression, anxiety and loneliness can actually be much better addressed through a more community-based solution. So the CCG have done some brilliant work in working with the local voluntary and community sector. And so that's been well established for about maybe 6 years now. And the idea being that is there an alternative for children or for young people as well? You're absolutely right, Steve. We are seeing increasing levels of distress in our young people, and there's some evidence to back that up. So the CCG are working with us and across public health and children's services to understand what else we can do that I think it was reported in local BBC News app recently that Teens in Crisis, our local charity, has seen the highest level of demand in its history. And it's a great charity. It does brilliant work, but we need to understand how we can best support young people at the moment. And there's been a huge change, hasn't there? Huge uncertainty. And I don't think we'll fully understand the impact on children and young people for some time to come. I can get you a fuller briefing. Perhaps I'll pop it in the next public health report about the exact detail of what's happening and where. Is that okay? Because I've not got that to hand, Steve.
Yeah, that would be really helpful. Thank you. Having a 16-year-old granddaughter, and talking to her and knowing about her peer groups and how they react, concerns. So that would be really helpful about the prescribing. Yeah, I say I missed your comments regarding domestic abuse, but I did read that, and knowing that we currently only have the only hospital in the Stroud area for domestic abuse, I was interested to read that there appears to be a rollout of more safe houses, etc., more safe places for women and children to go to. Is that actually happening now?
So I think that it's important to reflect a bit on our model of domestic abuse. So I think probably back in about 2013, we moved to a very much a more community-based model, because some of the engagement we did with victims of domestic abuse said that actually, sometimes it's preferable for the children. In a lot of cases, it's the woman, but not always. Men are victims of domestic abuse as well, but sometimes it's preferable to stay in your own home and do what we call target hardening. So you make your home secure because it's that individual's, that family's home, rather than taking perhaps the parent and the children out of the home into a refuge. There is a place for refuges in this discussion, absolutely. But our approach was, and it was very much around a system approach. It was the county council working with the districts and the police and various other organisations to do what we call community-based model of supporting victims of domestic abuse. But the Act is quite specific about what it requires. So I think on page, I'm trying to look now, it was either page 10 or page 48 of your pack. It talks about when we've been given this money for implementation of the bill, 1.1 million, what we're actually going to commission. So there is some more refuge accommodation, something around sort of specialist safe accommodation for people with particular characteristics. Maybe you might be from the LGBT community, you might be a refugee, you might be disabled, but you need something specific. Then some dispersed accommodation that's safe and self-contained, perhaps not in a refuge, but you can live independently. And then I think there's a discussion about once you've moved to this accommodation and perhaps your situation has calmed down slightly, then how do we move you on to more independent living? How can we help you restart? And then there was a move on or sort of second stage accommodation as well. So it's very much when I take the model that we think has worked well in Gloucestershire, apply that to the Act, and there'll be a paper going to Cabinet this month seeking permission to spend this money to buy this additional accommodation, as well as additional support in the community, because you can't just put people in accommodation, you need to give them the support while they're there.
Yeah, so you are saying that there will be some more sort of safe houses to what there is currently in the future?
Yes.
Yeah. Okay, thank you, Stephen.
I think we've got a question from Lisa and then Kate.
Thank you. Yes. Thank you, Sarah. Excellent report. I am quite interested in picking up and getting some more information on the support for young people who need mental health support, really. I know we sort of hear anecdotally that there's waiting lists that are, months and months. And if you present with anxiety, depression, any number of, mental health issues, especially as a young person, although across all age groups, that, you can't get help and treatment for a long period of time. Is that really the case? What is really going on that?
I think we're slightly veering into health service territory here in terms of the waiting list. So some of that, for example, the Council Child and Adolescent Mental Health Service is commissioned by a clinical commissioning group. So I've not got the information to hand to talk about their waiting list. I think as a general rule of thumb, we're seeing need increase across, it's not just Gloucestershire, it's across the country. We're trying to understand what that need is, because not every young person or child will need, that really acute end of support. So there's also a huge project, and we were granted some money, I think £5 million, I think the Mental Health Trailblazer, about 3 years ago now, and that was about doing mental health work in schools with specially trained staff. That's being expanded. I think the other thing to say is in the papers on page 43 or page 5, there's a link to what we call Be Well Gloucestershire. So if people were asking you, I've got my teenage daughter's in distress, what can I do? Or I'm a bit worried about them. The Be Well Gloucestershire website is a really good place to start, because it's all about how can we support our own mental well-being? What are the links? What are the services available? Because a lot of these are free. So we talk about Cluth and Quell, the services that we commissioned. I'm just looking through my paper now. So Cluth was for young people and Quell was for adults, but they're free online open access mental well-being websites. And also we commissioned the Gloucestershire Counselling Service as well. So if you look on the Wellbeing Gloucestershire website, it will have Gloucestershire website. It has all this information on there for you as well. It's also on our county council website as well, and it can be quite helpful to refer people to.
Sarah, I'm
Fantastic.
as well that there may be this may be addressed by the Children's and Family Scrutiny Committee. Is that right? That they probably would be looking into mental well-being of young people. So it like with all the other scrutiny committees, if members are looking at a specific issue, they might want to just observe other meetings. Certainly the Children and Young People Scrutiny Committee might also be doing work on this aspect, so you might want to look at those papers. Thank you.
Okay, thank you.
I think we've got a question. Oh, sorry.
So it might also be that mental health and wellbeing might be another topic for a joint scrutiny session with HOSC.
Yes.
Because of the overlap, it might be something that the committee might want to consider, because it can bring both sides together.
I'll make a note of that one. Okay. I think we've had a question from Steve. Kate, did you have a question?
Yeah, just a couple of things, more observations really. I know this was touched on, but I think it's really, really important to mention that not everybody asks for help. We only have sort of figures of those who are actually going to doctors, etc., and there seem to be huge numbers actually suffering. So it's useful to have that Be Well website. And I'm very interested in the sort of holistic side and the prevention and the channeling of things like nature, sport, arts, because we know that quite often, I just know it from my constituents, particularly those who've lived alone and been very isolated during COVID, that just trying to put them in touch with and having things for them to focus on and be involved in, and for children as well. And of course, all of these things also help people to keep healthy if they get involved in nature and walking and things like that, and sport, of course, and the arts to an extent. So I think that's worth mentioning. And then I just wanted to briefly go back to what Pam was saying about chairs and things in schools. It's probably worth mentioning standing desks, which seem to be quite the rage with osteopaths, etc. And a lot of new offices and things are looking at those rather than the posture of sitting down all day for so many hours at our desks. So standing desks where it's better for your posture and you can use your computers, etc. But it might be worth looking at that for schools at some point. Thanks.
I think, Lisa, did you want to come back?
Sorry, I had one other thing, which was I'm not really sure what I want to see here, but I am quite shocked by the statistics over weight and obesity levels. I mean, to say that 2/3 of the adult population in Gloucestershire is overweight, I mean, that's quite a lot, isn't it? I don't know. I just really think this was a group, because I think it is something that we should look at and see what we can do, really. I mean, I think, as a public body, and what can we do to help that? And for to say that half of those 2/3 are clinically obese is is really very bad. It has so many impacts, not just on those people and those individual lives, but obviously on the NHS, on services, etc., etc. We've got to get our population healthy.
I completely agree, Lisa. Completely and utterly. I don't think we're particularly out of kilter with the rest of the country. I think the other thing I would say is you've got an adult weight management services update. Now we have had pretty good what we call tier 2 weight management services. So tier 1 is your general prevention, a bit like what the services that Kate was talking about. Those general services, being getting out and about, being healthy, physically active, eating well, drinking moderately, not smoking. That general what we call primary prevention is a part of my team's role. But to be honest, since forever, I think we've always had a focus more on treatment, because we want, and in a way you need to have a focus on both, because we need to enable people to reach and maintain a healthy weight. And the report talks about some of the ways we do that, and we've got the Slimming World on referral, and we've done pretty well with that. But there's quite a lot of evidence that works for some people, but the criteria we're using for the additional money we've got from NHS England is almost like a tier 2 plus to people that need a bit more help. But what we haven't got yet is what I would call a whole system approach to tackling obesity. And the evidence tells us that it's so much more complicated than just what you eat and how much you exercise. There are so many other factors that influence that: your ability to get food, your knowledge about how to prepare food, whether you've got the equipment to do it. It's hugely complex. And that sort of primary prevention approach is as much about physical activity and there's wide determinants of health about your level of education, your income, as it is around just what you eat and how much you exercise. So the Health and Wellbeing Board have endorsed that approach, but we haven't got any resources to take that forward at the moment. So that's where we've been in that position for a couple of years. So the primary focus then is working with people that are overweight and obese and try and enable them to reach a healthy weight.
Okay, yeah, I mean, it's the same everywhere, isn't it? We're dealing with the issues and having to react to the actual problems rather than preventing them in the first place. So that's interesting to hear that you've got a strategy but no money to implement it. Okay, yeah, don't know how we take that forward. Perhaps something to bring to council. Thank you.
Thank you. Mark McKenzie, did you want to ask a question? I think this is the last one.
Yes, absolutely. Picking up on Lisa's point, those of us who were on the Children and Families Scrutiny Committee, I forgot what day we are, I know it was last week, will have learnt of some of the horrendous figures and things that the social care side have to cope with. And one example was given that in some of the accommodation, they have to make provision for young teenagers who weigh as much as 30 stone. And I find that truly depressing and shocking. And so this point about junk food and advertising on television and any moves that the central government can make, and us as a local authority, awareness through education and everything else is so crucially important. And it brings me back to Sarah's report, which I find if you put this together in a couple of days, I think is absolutely brilliant. The breadth of what you're reporting on and the complexity of these things is immense. I just question how the residents of Gloucestershire, and for that matter any county, are fully aware of the services that we are able to offer. I mean, a lot of sort of local authority literature is a bit dry. It's probably getting better with graphics and so on nowadays, but it's important that people out there really do know that the breadth of services that we can offer without it being made too sort of gruesome, because a lot of these topics are sad. But I applaud what you're doing. But this business of going back to the obesity, it covers all ranges. And I think it's the more shocking when we learn about the children. Us old adults, we probably over the years have misbehaved and we are overweight, but it doesn't compare with some 10, 12, 15-year-olds who've got their life ahead of them. That's all I wanted to say.
I think the number of morbidly obese children is relatively small in Gloucestershire, but it's about making sure that we've got the right support for them and how we can help them to go on to lead healthy adult lives, isn't it? I think your point about promotion of our services in public health, we commission out our services because a few years ago we were called a commissioning council, so we don't provide any of these services ourselves. So we've got some in one of our health and lifestyle service. You'll see promoted quite heavily the GP practices. It has its own social media channels, so it's about how we promote the services that we commission. And I think a lot of it is context specific. So in terms of things like promoting domestic abuse services, a lot of those are available in places like police stations. If you go to the hospital, you probably don't go into the women's toilets, but I guess that's quite often you see things on the back of toilet doors, spaces where perhaps victims will go on their own without their abuser, and they can take a picture of the number or note it down or whatever. So you tend to find them in lots of places if you look for them and look for some of the provider information, particularly because some of it's very nuanced and it's not something, for example, drug and alcohol treatment services that most of the population will ever come in contact with. It's quite specific, and quite often people are referred in with the agreement perhaps by someone from the police or in the health service and refer someone in with their agreement to these services. So they're not necessarily universally advertised because that wouldn't necessarily help us attract the people that really need the services.
Okay, thank you very much. We caught everyone in the... Sorry, Mark. Mark?
Tim, can I just comment briefly?
Tim, yes, surely.
Just comment just on the obesity issue, which I think we all share that concern. So is it worth just mentioning the pilot on the child weight management scheme that Sue Weaver is leading on in your team? I met her recently to go through that. We have got some additional funding. I think she's planning to bring a report to the Health and Wellbeing Board.
Yeah, so we've got some funding. We've been doing a pilot around working with families to tackle healthy weight in children, recognising there's absolutely no point in doing something for the child because the child eats within a family situation. So we've been doing some pilots in Gloucester and the Forest of Dean, and really innovative pilots that are sort of trying to push the boundaries of what we understand works in relation to childhood obesity. So last year we got some additional funding to finish the pilot, and we're currently pursuing how we might enable that service to be recurrently funded. But we can certainly bring an update on that. And at some point there is a report going to the Health and Wellbeing Board as well. I think what will be helpful is perhaps to wait for the National Child Measurement Programme data that's been referenced in the performance report later on, perhaps for the next lot of data to be released, and we'll bring the report on the weight management service as well because it provides quite a lot of context.
Yes.
That way as an action, Joe.
Have we got any more people wanting to ask a question? Or can we proceed to number 5?
No more questions. No more hands raised, Chairman.
Thank you, Joe. Adult Social Care Report. Sarah, again.
All right. Apologies, you've got me again. So this is a report from the other half of my job from the Adult Social Care team. So talk through some of the bigger areas of our work. This is a much bigger area of the council budget, around £155 million. So we've got some key elements here. So we talk about the enhanced independence offer. This is a new service we are implementing currently, and it's about how do we enable people to leave hospital and support them who can't just go home and be picked up by a relative and go home. They need some extra support. So this is quite a complex area, and it's really important to what we call system flow. We need to make sure that the right people are going to hospital that benefit from hospital treatment, and then we're enabling them to come out quickly and go home with the right support and care. So that's our enhanced independence offer, and we can certainly bring further updates to you if you'd like to have a more in-depth look at that. Complex care at home, there's a brief update there. Again, a lot of our work across health and care is around supporting people to live independently in their own homes. And so making sure we've got health services there for them at the right time when things do become more serious, but not seeing going into hospital as that default option, because most people are much happier in their own homes with the right support. There's an update there about the financial support that we've received to pass on to care providers during the pandemic. And this remains quite a big piece of work for us to ensure that providers, and we've talked about providers, care homes, residential care, nursing homes, and some drug and alcohol treatment, the residential drug and alcohol treatment services. So some money to increase the workforce capacity, acknowledging there's additional work to do with additional cleaning, and of course if they've had people self-isolating. Rapid testing to ensure that they are able to make best use of the lateral flow test they're required to do twice a week, as well as the PCR tests. And then on page 57, there's a summary of all the money that has been allocated to the care sector since the beginning of the pandemic. So there's a section on health and housing about how we are looking at that wise determinants of health, and we're really focusing on better outcomes for people and recognising that housing plays a role in that. There's an update on learning disabilities. This is quite a big area of work for us, and I think we probably could have put in a bit more explanation for you. So Transforming Care is a national programme around how we enable individuals with quite significant and severe learning disabilities perhaps to be moved either to independent living, or where that's not possible, into care homes back in their home county, because quite often, because of the restriction in supply of suitable care homes, people were placed quite a way away from home. So we've done particularly well about bringing people back to Gloucestershire. And there's our annual health checks there. We know that people with learning disabilities can suffer from inequalities and poor levels of physical health, so the annual health checks are really important. And lastly, the mortality reviews, because we do know that people with learning disabilities do die younger on average than someone without a learning disability. So the Learning Disability Mortality Review Programme is a national programme, and we participate in that to make sure that we're learning from each death and making sure that the services are as responsive as possible. So Adult Single Programme, I mentioned this in the induction programme. That is our transformation bit of adult social care, and then this particular update just talks about some of the work we're doing around technology and the Digital Innovation Fund, trying to support community organisations to enable digital inclusion. An update there on our Liquid Logic adult system. This is a short update, but it's been a huge piece of work for adult social care for many, many years, and we have finally moved over to a new system which will enable us to do some more robust review of our data and help us manage our performance. So that's been probably about a 3 or 4 year journey for us to get to that point. Some of you might remember Margaret Wilcox talking about the ERIC system, but we are now using Liquid Logic, and that process has worked really well. The staff have been amazing in terms of how they've adapted to a new system at what is a very busy time. The next section talks about, it's called a GHC contract update. I apologise for the acronyms. GHC is Gloucestershire Health and Care NHS Foundation Trust. So they're our community mental health and physical health provider. So we're working with them on a number of different things, and there's an update there. Something on enhanced care home support. So we've put some additional funding in during COVID into our care home support team around infection prevention and control, and now we're looking at how we can broaden that out to provide some more broader support to care homes around the range of issues that they're grappling with. We talk about our market management responsibilities, and there's a bit in there about our predicted demographic change over the next 20 years. So we're just looking at what, based on our predicted demographic change, what sort of care facilities do we think we'll need in the longer term, and how do we bring that to fruition. So for example, from our analysis to date, we know we're going to need some more specific dementia care. We think we need some more neurological care going forward. So how do we plan that in? How do we make that happen? And I think Steve, you asked for an update during the induction session. We're going to bring a full report back to our meeting in September. And then finally, there is an update there about Proud to Care. So we have a Proud to Care programme because we want to promote caring as a career, and we know that recruitment and retention of staff into the care sector can be challenging, particularly as we're moving through a pandemic. So our Proud to Care work has never been so important. And lastly, the Red Bags are an initiative we're rolling out with the CCG about how we can improve the flow of people going from care homes in and out of hospital, making sure their documents and their belongings are kept safe, and using the Red Bags. And there's a poster at the end of the report that talks about that. I'll pause there for any questions.
I think you're muted, Stephen. Sorry. There you go.
That's a terrific programme, Sarah, and you just wouldn't believe the amount of involvement we have in social care already, unless you explained, it's explained to you like you've just done. It just makes the mind boggle what you get involved with. Do we have any questions, please?
We have a question from Councillor Kate Cody.
Kate?
Thank you. Yeah, I'm interested in the Parks Home project. It mentions a pilot. I wondered if there's any kind of report we could see on that. It does say that it was obviously successful and another 200 homes could be insulated. I wondered, do you have a number? Do we know how many park homes there are in the county? Because I've got 7 sites within my own division, and some of them are quite small. Not all, but I did wonder, because in a lot of the sites they are older people, quite frail. There's an awful lot of health issues, quite severe. So that this looks like a very good project in terms of insulation and fuel poverty and those sorts of things. But I wondered if there's a bit more detail, please, on that.
I'm sure there is. I've not got it to hand, but we could perhaps note that down for the report next time, if that would be helpful. Or put it on the work plan, whatever we can find. I think there is an evaluation, in which case we could circulate that. But if you wanted to have a bit more in-depth scrutiny of this issue, we can certainly provide a more detailed report. But perhaps that's a work planning discussion.
Yes.
It would be
evaluation.
Thank you. It would be useful to know, where the 200 homes that are going to get the insulation are and how they were chosen and all that sort of thing. And if there's any more support for any of the others. Thank you.
Any more questions?
I've got no more raised hands. I don't know if anybody wishes to. Oh, Terry Hale is waving.
Terry, sorry. Think you may be muted.
Yeah, I was. Yeah, just got it. Who can I get in touch with regarding patients going to hospital from care homes? That I got a complaint that come in only yesterday that and I haven't actually done a lot of work on it. They was picked up 4 hours before their appointment time, and obviously the return journey hopefully would be quicker. But if it was, that's 8 hours that particular person was sat on the ambulance and in the waiting room. He was incontinent and, of course, very embarrassed and so on. Who was in charge of the transport? Because we got the local depot in the Forest of Dean.
So that would be the CCG. So I think Joe can send you, probably Becky Parrish's email. I think Becky might be the person to start with.
I can pick that up. Yeah, I can pick that up, Terry, and point you in the right direction. Okay, but that's a HOSC issue. Yeah, that's fine.
Yeah. Okay. Thanks very much.
Do we have any more questions, members?
No more questions, no more raised hands on the screen, Chairman.
Thank you, Sarah, for another invaluable presentation. We all learned so much. We now have item number 6, the Chief Fire Officer's update. We no longer are responsible on this committee for putting fires out. That's a new separate scrutiny group, but we are totally involved in the other services which the Gloucestershire Fire and Rescue Service are involved in, such as trading standards, civil protection and coroner services. And I'd like to ask Mark to give us some words of wisdom about those. Mark, you're muted.
Better. Can you hear me?
Yes, thank you. That's good.
Sorry, yeah. Hopefully my computer will pick up the sound. So, Joe, if I could ask you to share the presentation I've forwarded. And
if you can just bear with me a second. If you keep talking, and I will share in a second. Thank you.
Okay, thank you, Joe. Obviously, councillors, you'll have recently received a report from myself regarding the Community Safety Directorate. So this is just to bring you an update on what's current at the moment. which I'll go through in a second once the presentation shares. So as Councillor Hurst was outlining, in terms of fire, there's now a dedicated fire and scrutiny committee. So this presentation and overview will focus on the civil protection team, the coroner's office and trading standards. So if we move to the next slide, if you would please, Joe. So in terms of the headlines of what's going on at the moment, the civil protection team continue to support the county and district councils to be compliant with the Civil Contingencies Act. We're working closely with their multi-agency partners as key members of the Local Resilience Forum. All of their work functions, apart from face-to-face training, have resumed. And to give you just an example of some of the work that's ongoing, is we're working with service areas across the County Council to strengthen business continuity management, and we're achieving this through conducting business impact analysis and business continuity plans to increase our organisational resilience. We continue to work with GCC colleagues to revise, resource and train their members of staff to deal with emergencies. Particularly around, we've been working with the C19 hub colleagues to scope adapting the model as a tool for public communication during large-scale incidents. We're also working with district colleagues as per our service level agreement, as each district has a civil protection work plan, and we support that work directly in each of the 6 areas. The SLA has been approved at the last Gloucestershire Prevent Partnership Board meeting, and this is for the civil protection officers to provide secretarial support to the board. And in terms of Prevent Partnership, I'm not sure if councillors have previously been involved in that area of work, but it's to deal with individuals that are starting to show a tendency to be involved in extremism, and about trying to channel people away from being drawn into the wrong type of activity, which may ultimately lead to acts of terrorism or of that nature. So there is various work streams that are set up in terms of prevent and channel to try and address those issues. Overall, the service is delivering business as usual functions, and that covers civil protection. I don't know if there's any teams questions. Sorry, if I could just pause for a moment to allow you to ask questions.
Do we have any questions about civil protection? Looks like that's a no, Mark.
Okay, thank you, Councillor. If we move to the next slide now, which is the Coroner's Office. The Coroner's Service continue to work with its statutory duties under the Coroner and Justice Act, and that is to investigate all sudden, suspicious, unexplained or unexpected deaths. All our coronial functions continue to operate from the Coroner's Court at Barnwood, Gloucester. We've continued throughout to book in and release deceased persons and undertake autopsy activity as per the guidance of the Senior Coroner. In terms of complex inquests, which were stood down during the lockdown period, these are now starting to be scheduled for later in the year. Essentially, the service is looking to return as business as usual. There is a small backlog of long-term inquests which the Senior Coroner is currently rescheduling. And visitors to the centre are still limited, but staff are now largely working on site, with some still remaining to work from home where possible. Mortuary practice continues with the guidance from professional bodies, and the Senior Coroner only instructs internal examination where it's absolutely essential to do so. So that's the key aspect of the Coroner's Office. I'll just pause again if there's any questions.
Anybody want to ask a question? Kerry?
No.
Sorry.
Okay, so if I move to my final slide, which is trading standards. Trading standards have resumed work in all areas. Programme inspections and new investigation work is already underway, and legal processes have resumed. Of particular note, food premises inspections focused on food standards, composition and labelling work is already in hand to complete the backlog by the deadline of June 2022, sorry, which is the date that's been suggested by the National Food Standards Agency. An area of work is the product safety post the EU exit and withdrawal from the single market in goods place greater responsibility on all importers, and the services focus on identifying small retailers, especially those that are operating online, to measure their compliance and advise where appropriate. Ongoing work to align the training standards fully with GCC requirements in terms of contract management and risk management is underway. Ongoing, we're conducting a review of the work the service conducts, and we're considering our statutory duties and intelligence-led priority areas of work for the future. So if I just pause there for questions, Councillor Hurst.
Thank you, Mark. Any questions, members? No. I've noticed, Mark, about smallholders who have small holdings, a few animals and a few whatever, and there seem to be a high incidence of ill treatment of their animals. And is it trading standards that deal with ill treatment of farm animals?
I believe it is in that respect, yes. If it was a domestic pet, then it'd probably be the RSPCA. But in terms of if it's a farm or a trading business, then yes, that would come under trading standards to enforce. And we have been doing inspections during COVID in relation to that.
Thank you. And you've been quite successful at prosecutions, haven't you?
We have, yes. And what we do is we do publicise those to promote the work of the obviously trading standards, and to also make people aware of their responsibilities. It's a good case to, I suppose, highlight through where malpractice has happened, people's legal responsibilities, and the fact we will proactively enforce legislation where it's right to do so.
Okay, thank you. Any questions, members? Kate?
Very briefly, just interested because obviously the borough officers do certain inspections of food premises and things like that. I just wondered, presumably you just work very closely together, but what's the difference between trading standards and what they do at the districts and boroughs? Just wondered.
I mean, that's something I'd have to look in more specifically myself as well, Councillor. We do work closely with the districts and with other enforcement agencies as well, where there's a crossover with legislation and responsibility. So, yes, I mean, that's why it works very well with trading standards being based in water wells here with fire, because some of the issues overlap with their fire safety inspecting officers. When we conduct inspections around the regulatory reform order, you often find there's other infringements around food health and hygiene, or importing of goods that we can deal with all in one visit and share that intelligence between departments.
Thank you. I think Sarah wants a word.
Sorry, I can't get off mute. Sorry to interject, Mark. I think as a former technically civil and environmental health officer, I used to work for a district and a unitary authority doing the food inspection. So the legislation is different. So the EHOs from a district perspective look at food safety, whereas the trading standards officers are looking at food quality. So in legislation, different aspects sometimes of the same legislation and also separate pieces as well. So that's, and environmental health have other duties, as do TSOs, in terms of what we're doing when we're out and about. But I think they do work aligned as closely as possible. But there's no duplication, I suppose, in answer to your question.
Thank you.
It's really interesting.
No more questions? Steve?
Yeah, thank you. Thank you, Mark. So are you saying then that during COVID that officers haven't been able to get out to premises? And I know that, they go into premises and check, dates on different things, if things are still being sold with use by dates and all that sort of thing. So that hasn't happened, but you've got such a backlog that it will take until this time next year to actually get out to premises and check that sort of thing.
Yes, Councillor. So if we've had a member of the public contact us with a direct concern, then we've gone out and inspected and done a visit. But what we have done is, whereas in the past we'd have proactively gone and audited compliance, we've reduced those visits because of the COVID restrictions. But now the restrictions are being lifted, we'll get back on with our inspection regime and start to ensure we comply with the Food Standard Agency guidance and complete those visits by June 2022.
Yeah. And could I ask, does trading standards still go out and sort of check things like scales in shops and that in petrol, you know, you're still getting your litre of petrol, that sort of thing. Does that happen through trading standards?
That's one of the areas of their responsibility. I mean, over the years, I think the size of the team has been reduced quite considerably. I think we've got about 18 or 19 trading standard officers. So they have to pick various themes that they work on based on intelligence and issues that arise. But that is definitely an element of their work.
Yeah. Okay. Thank you.
Lisa, I think you want to ask a question.
Yes, just quickly. Is it the responsibility of your team, Mark or Sarah, to do any of the COVID checking up on whether people are quarantining after holidays and things, or is that nothing to do with anybody here? Or are we even doing that?
Well, I'll let Sarah come in on that one, but trading standards haven't been involved in that, but I'll let Sarah respond as well.
So there's a nationally commissioned service through Mighty. So if you're from a red country, you go to a managed quarantine hotel, and that's been commissioned nationally by Department of Health and Social Care. And we don't yet have a red hotel in Gloucestershire. Who knows if we will in the future, but we have done an exercise to be as prepared as we possibly can if that did happen. If you're coming back from an amber country, currently you have to self-isolate for 10 days, and then there are periodic checks by Mighty, this company that's been commissioned to check. But I think it was in the news yesterday, and it was released in a government document last week that there'll be new guidance issued this month. So if someone comes back from an amber country and has had both doses of the vaccination, that they won't need to self-isolate on return. But that's not in place yet. And of course, I'm not quite sure what happens to children that obviously can't be vaccinated at the moment if they come back from an amber country. So still some unknowns there.
So as a local authority, we're not in.
No one's helped
to do any of that checking or looking out.
It's been an issue, because all directors of public health have asked that data shared with us, because also from a welfare perspective, we've got really good services working with fire colleagues and district councils. So we could offer support to people that are self-isolating to make it easier, because we want to make self-isolation easy. And we're doing that anyway. For example, if I had to, or anyone had to self-isolate, we can call and we perhaps help with collecting a prescription or whatever. And we want to give people no reason to have to leave the house during that 10 days. And we would rather be told and have more work to do and offer more support to these individuals, but there isn't a direct data feed, so we don't know who they are, unless they test positive, in which case we would find out through our daily uploads of data. It is a gap.
Yeah, so that would be people who are doing, sort of test to release, that day 2 and day 5 testing post return from their holiday. So you would then know because they had tested positive, and you'd get that feedback about, or that data on who in your district area has had a positive test, but you're not doing it. Okay, that's interesting. Okay, thank you.
If I could just add as well, just for the council's awareness and wider awareness, really, where we've had businesses continuing to trade, we have had to deal with enforcement action. So I can give you an example without mentioning the name of the business. There was a garden centre that continued to operate and wasn't maintaining the social distancing guidance as it should be. We provided them information. We didn't take enforcement action immediately. We went and visited them, provided them advice as to how they should trade and operate during the restrictions. And then subsequently, the police were contacted and made aware that this outlet was still continuing to trade. Although they'd moved how they were operating, they tried to shield it behind some trees. So we actually then went and took enforcement action, because the police officer, when they responded, it was all on body camera, and of course they were able to film everything. So we have tried to work with trade and commerce and take a pragmatic approach, but where people are clearly flouting, once we've given them guidance, where they're flouting the regulations, we've then enforced it.
That's good. Thank you. Thank you.
Can I ask a question, Chair?
You can, Pam. Go ahead.
I'm going to bother, but I will. But it keeps coming in my head. I've gone back to animals and all that, and I'm glad that you are going around farms, etc., in small loadings. And I know I die for an animal, but I if anything happened. But anyway, where I'm going with this, and I said to someone, well, what are you doing eating those cows like that for? He said, well, they won't know, they're going to slaughter in a minute. I thought, how do you get over that? And these bloody travellers, they're gypsy horses. I'm dealing with them all the time. They'll probably be in King's Zone this week. They're all tied up outside the heritage, horse in cart. There's poor horses, oh, and they go home drunk on the horses. And it's horrendous how they beat those horses. I know we go up to Twigworth, I go up there, up to Sanders Lane. And I spoke to the old travellers. They say, Pam, they say, it's not us, it's the young ones. I know you picked on that. And I know I'll have to go and lobby over the act on animals as such. But how, they got a law of their own. How do we, stop all this? The police don't want to know either. They said they can't prosecute them. Those poor horses. You go along to the heritage tomorrow and you'll see them all lined up outside. Thank you.
And obviously, Chair, is perhaps at the next.
I can't hear.
Oh, sorry. What I could do, Councillor, at the next scrutiny committee is bring an update on our animal welfare activities and what we do around enforcement.
Yeah, but
Yes.
I need to go along and be a secret shopper. Oh, poor horses, poor people. Right, thank you.
Thank you, Pam. Terry? Muted.
You've been here 4 years. Well, I would like to ask Mark if he'd come down into the forest, and I would take him for a trip around, because we got, obviously free roaming sheep. We've got boar. We've got a lot of abuse with animals, especially sheep. And I know there's trading standards. We work with them, and they do a marvelous job. There's also the fright of reprisal with some of them. But I would like you to come down to a meeting with us. I've taken the trading standards down, but to give you an opportunity to visit and see the unique area that trading standards has to deal with, and the people involved in the shepherds and the commoners and the verders. It would be an interesting meeting if you could come down.
Yeah, well done. Well done.
I think Mark's volume's too low.
He's gone.
Can you hear me? Sorry. Can you hear?
Yes, that's fine.
Apologies. What I was saying, sorry, Councillor Hale, is I'll liaise with Joe about making that visit, and I'll bring Karen with me, who leads on trading standards, and we'll happily have that conversation and see.
Yeah, Kate has come down with us, so so if she'll escort you down, it'll be good. Thank you very much.
Thank you.
Do we have any more questions or comments, please?
No.
I've noticed that as an action, and we've got no more questions, Chairman.
Thank you. Thank you, Mark. Thank you very much indeed.
Thank you, Councillor.
Now, item number 7, Q4 performance report. Now.
Are you okay, Chairman?
Yeah, I'm just getting it on the screen.
Okay.
Yeah. Pages. Sorry.
We just lost you then. Sorry, we lost you. Your microphone.
We got a good few pages there of performance reports. I'll take them as read. What we're looking at are the movement through the periods.
I think what we were going to do as a follow-on, Chairman, was just ask if there's any questions to which officers or the cabinet members present at the meeting might wish to comment on or draw any points out. I don't know if any cabinet members want to draw any points on their areas.
Firstly, we've got adult social care performance with Kathy Williams and Carol Holloway Martin.
Thank you, Chair. I think I'd just like to draw two comments, two members' insight. The first one is that the COVID regulations that were enforced and we're still recovering from mean that some of these targets were suspended. So we don't have full data as yet. So in the future meetings, we'll have more up-to-date information that is not clouded by COVID. So that's one point I'd like to make. The second one is to draw members' attention to two of the boxes, really. The first one is where it says good performance, high and low, and the notion that bigger is better or smaller is better. It's a comparative issue, and it's one that demonstrates trend and gives an idea of direction of travel. So that's one second thing. And the third thing I'd like to identify for members is some of the graphic coding where it says against a target. And there's a key to symbols on the second page of the report where a star indicates performance is better than target. I think from my perspective, when I was a member of committees and trying to understand what these performance things actually mean in reality, if you hang on to those three things, notwithstanding the COVID regulations or the suspension of numbers, the bigger is better, smaller is better, and the star indicator are perhaps the first ones that members might go for first, and then test out either with questioning or looking at previous reports.
Yes.
So from my perspective with adult social care performance, I think we've managed to sustain performance and go above what we can do given the circumstances. But in terms of future reports, they will have more up-to-date and relevant information on them. So this is a snapshot, which is okay. But as we move through a process post-COVID, then the information will be more relevant, I think. Thank you, Chair.
Thank you, Carol. Now, as Carol said, it's good performance, high, low box, bigger is better or smaller is better, and the illustrative symbol regarding the actual performance. Green star is good. Thank you, Carol. Now we come to Tim. Are you still with us, Tim?
Yes, Chairman, I'm still here. Just a couple of comments on the figures in front of you. I mean, I'll just run through them briefly. We have a green star of the percentage of pregnant smokers achieving the 4-week quit, which is good news. Perhaps it's not surprising that we've seen a bit of a reduction in performance, as it were, with relation to alcohol issues and opiate issues. It's worth saying that we commission our services out to various people, CGL in this case, who I think do a very good job. And clearly they had to change the way they work during the pandemic, so they had to do things more remotely than physically. Pre-pandemic, I visited their offices in Gloucester, Cheltenham and Stroud, and I think they do a good job. But work is going on with them and others to see how we can correct this. Perhaps not altogether surprising that that trend existed with the pressures on people during lockdown. That's the only comment I'd make, but I'm happy to answer any questions with Sarah's help.
Does anyone have any questions for Tim? Ably supported by Sarah. No? Okay, thank you very much. The next Cabinet member is Dave Norman, although he's not with us today, I don't think.
No, David sent his apologies. He had a double booking, I'm afraid, so he's not with us today, David.
And Kate, you can see regarding safe and well visits there. You asked a question about visiting, didn't you? Or am I wrong? That's been affected by the new work processes due to COVID, as have one or two other sections of this report. But we're doing well on safe and well visits undertaken to those in high-risk groups, as well as the number of accidental dwelling fires and the number of killed and seriously injured people. We're making inroads into the targets on those three items. Who is next? Just strategic risk summary. Who does that one belong to, Joe?
I think it's just a summary, and if members have questions, then we're happy to take questions, and if we can't answer them here today, we'll take them away. So it's really for members to read the performance report prior to the meeting and raise any questions. But that was useful, Carol, to give some indications of what we were looking for, and also the member induction session when we had Kelly from the performance team at the induction session gave some good ideas and useful information on what members might be looking for in the performance. As Carol has said, I think going forward the reports will be more revealing. So if there's anything specific, that any questions wish to be asked, I think Kate, did you want to come in there?
I think this is in trying to do it on iPad's not really easy. Dave Norman. So I'm looking at road safety, and obviously I'm delighted that smaller is better, but I do think there should be a comment in there about the fact that traffic wasn't on the road because we were in lockdown. I think that's really, really important. So, you know, it's great that there were fewer deaths or, seriously injured people, but I think we really should make a note of that, because particularly as we're unlocking and traffic appears to be worse than it actually was pre-COVID times. And that's obviously a mixture of things like people not wanting to use public transport, possibly people who were car sharing not prepared to do that. But it's also, I know a lot of cyclists who were cycling in lockdown because they could, because the roads felt safer, and they're now not able to do that. And I mean, we cycled to Sainsbury's on, I don't know, I live in Tewkesbury, and we went to Gallagher Park on Sunday. I have never seen so many cars on a Sunday. You know, trying to get off the path onto the road, it was over 10 minutes trying to get off, you know, back into the road. So it's noticeable, more than noticeable. But so I do think that there should be a comment there about that. Thank you.
Mark, in Dave's absence, Mark, do you want to make a comment at all? I think you might be muted. Yeah.
Sorry, it's not. I'm not on mute. It's just my computer's not picking up the volume very clearly. Sorry. You know, I think the councillors summarised the situation very well. That probably traffic has picked up during the period of COVID. The volume of traffic decreased, so that's a valid observation.
Okay, thank you.
Thank you, and I've made a note of that, Kate, and we'll add that to the minutes. Thank you. I can't see any further questions, Chairman.
Neither can I. That's good. We now come to the work plan.
Chairman, do you want me to just run through what we suggested at the induction session, and also pick up a few things that we've noted here at this meeting? I've got a very useful grid that I'm going to share with members of the committee after the meeting, which actually sort of lists each of the meetings for the next year, going right through to actually January 2023. And we've just highlighted a few dates for potential items to come to certain meetings. The items that were highlighted during the induction session, I think we've got a little bit of feedback from somewhere, it might be yourself, Chairman, is that we've got the market management that Sarah was referring to, overview, that I believe, Sarah, we're going to try and bring something to the September meeting to give a little bit more detail on market management issues, recruitment, staffing, etc. That was something that was picked up at the last meeting. We've also got for the September meeting the Gloucestershire Safeguarding Board annual report. Sarah, do you want to just give a little bit of an intro on what that will be?
So in my induction briefing for adult social care last time, a couple of weeks ago, we talked about the adult safeguarding aspect of adult social care. So we're required to have an adult safeguarding board with an independent chair, and each year they produce an annual report, and it gives a summary of the work they've carried out to date, and also some really useful summaries and some case studies where we've had trying to take serious case reviews and the learning that's come from that. So I think it's a really good informative read, and we're required to bring it to scrutiny and through the GCC governance processes. It will be ready for September, but equally it could come to the November meeting if that's what members would prefer.
Sorry, Stephen, I think you're on mute. Do you want to seek a view if members want to see the annual report at the September or November meeting?
Yes, that would be good.
Okay, I'll pop that down and we can see how it slots in with the other items. Another item we're looking at is the contain outbreak management funding. Again, that could be a November item. We talked about domiciliary care report. We thought about the new year, so maybe January. Certainly for March, and the chairman and the chairman of the Health Scrutiny Committee, Councillor Andrew Gavels, met recently with Sarah to maybe think about items for a joint meeting with the Health Scrutiny Committee. We've earmarked, and we will seek your views, a possible joint meeting with the Health Scrutiny Committee in March, 15th of March meeting next year, which allows both committees to sort of get a good understanding of items and reports and the work that's involved in their individual committees. So the 15th of March could possibly be a joint meeting to review Winter Plan, which is the Winter Plan which will affect the NHS and the services, public health services, see how the Winter Plan fares through dealing with COVID and being double vaccinated. New guidance on system flow. I think Sarah might want to elaborate a little bit on that one. And health equalities. Sarah, do you want to add anything to that about the joint meeting?
So a couple of years ago, adult social care and public health were scrutinised alongside health and the Health and Care Overview Scrutiny Committee. And the decision was taken to split off adult social care and public health into its own scrutiny committee. The problem we have, and it's come up a few times in the discussion today, is that you can't neatly divide public health and adult social care away from health because we work so closely together all the time. And particularly, we're dependent on each other for funding streams. And I think the issue around winter, although the pressures on the system this week have felt like we've been in winter, it's been very busy. You might have heard on the news our hospitals are very busy. That in order for the health system to work effectively, it needs to work hand in glove with the adult social care system and to make sure we have this thing called flow. So we're the right people are going into hospital who need treatment and we're able to move them out quickly, giving them the right support to go back to an independent life if they're able to. And that might mean going home with a package of care. It might be a short stay in a residential care home, or it might be a longer stay in a residential nursing home. So part of our job in adult social care, it's not our whole job, it's a relatively small part of what we do, but it's really important for system flow, because otherwise if your hospital gets clogged up, you can't then have people coming in the front door via an ambulance or walking in through ED. So it is really important. I think my team and I spend a lot of time on calls with the health service, and we think this winter will be different. So obviously we're not expecting to have high levels of hospitalisations from COVID because of the vaccination programme, but we haven't been exposed to seasonal flu for a year. And whilst we had the vaccination programme, we were all locked down last winter, and we had social distancing, we had masks, we had frequent hand washing. And I really hope some of those things remain in this winter, but we're expecting to see higher levels of flu, higher levels of norovirus, and some residual COVID. So we're anticipating winter will be quite tricky. So the winter plan the NHS is required to write with us in adult social care is really important. So hospice plan to scrutinise that, I think in September, Joe, I think Andrew said, didn't he? But the idea was of a joint meeting at the end of winter in March, if we really had it for us to scrutinise jointly our approach and what learning we can take from that, because it's as much an issue for the county council as it is for the local NHS services. That's some of the thinking behind it.
Thank you. Can you help with me? Could you explain something for me, please, Sarah?
I'll try.
Last winter, flu was almost exterminated. Is that correct?
saw low levels of flu, and we still had the flu vaccination program. What we didn't mix as we normally do. So you catch flu in the same way you catch COVID. So it's droplets, it's coughs, it's sneezes, and then those droplets going onto hard surfaces or being inhaled, and then you touch a door handle, and then you touch your eyes or your nose, your mouth. So because we were not mixing, and particularly our more vulnerable populations, our older people were not mixing as much. Some were shielding still. We had a renewed focus on really good hand hygiene, wearing masks, coughing into your elbow, into tissues. And we saw very low levels of flu, which is good. But what we, and I think this has been debated quite a lot nationally, what we suspect now this year is we won't have built up any immunity to the viruses circulating. So each year there is a
different
strains about which strains to include in the flu vaccination. So I think it adds another layer of complexity to how we'll respond this winter, because we're going to go through the next stage and the roadmap on the 19th of July. We're going to be mixing more. So what's the outcome of that going to be? And whilst we might be fully vaccinated against COVID, we don't know how we're going to respond to flu. And colds and flu as well, norovirus, I think it will add up to extra pressure on a health service that's trying really hard to catch up to all the elective procedures that were missed due to COVID. So that's why the winter plan is so important.
So flu hasn't been exterminated. It's a matter of watch this space.
I don't think it's gone away at all. I think that we were just not necessarily circulating enough to catch high levels of it, if you like. We were just locked down, weren't we? So it hasn't gone away.
Yeah.
And we don't know. We watch the southern hemisphere for patterns around flu because they're in winter now, and that informs what we do in the northern hemisphere. So sadly not, flu will be with us this year, and we suspect it might be quite a tricky flu year. So that's why we're preparing.
Thank you very much, and better knowledge now. Thank you.
As an action point, Chairman, what I will do is make sure this committee are informed of the report and the discussion at the health scrutiny meeting on the winter planning process. Yes, we're looking probably early October to allow the plan to be developed. So I will inform the members of this committee so that they can engage with the planning process and what is proposed to address any concerns and expectations about flu. And then I've noted down for the joint meeting in the 15th of March 2022, we will review that plan and the experiences throughout the winter. Thank you.
I'd make some notes about some other possible subjects, one of them being obesity.
Yes. Yeah, that's on the list. The list of if you might want to add to these, Chairman, but we've got mental health as an item that we can plan into the work plan. Certainly concerns about obesity and the impact on services and the weight management service. I think that's what Sarah suggested, that we might include a report at the next meeting as part of one of the reports.
Yes.
Market management, 7th of September, we've got that earmarked as a report to come to this committee. There was a suggestion about Park Homes project, which we might include in one of the reports. And then Mark has kindly offered to bring a report or include in his report for the next meeting in September the animal welfare activities. That's being undertaken. That's my list, Chairman. I don't know if you've got any more.
May I ask a question, please?
Yes, ma'am.
It's all about the flu. There seems to be a lot of people on about shingles now. Is it quite big here in the city? And about shingles injections. Is it necessary to have a shingle injection? And if one has had shingles, do they need an injection? But it's everybody's talking about their emailing or texting. I don't know what they're doing, but injections. What's it like, Sarah?
So there is a routine shingles vaccination program. As far as I can recall, it's a one-off vaccination. I think I'd have to check, Pam. I think you offered it in the year you're 70, but I'd have to go back and check. It's been a long time since I've thought about the shingles vaccination program. I'd have to check what you would do if you'd have shingles. I'd have to go back and read the detail. I can include a little paragraph in my report next time on it, if you'd like, just a bit. Or actually, if you probably need it a bit sooner than that, don't you? I'll check with the team, and we'll send an email round. We'll put a little paragraph in the notes that Joe prepares, just so you've got that. You don't have to wait 2 months for a response. Is that okay?
With all these injections going around, one doesn't know what injection to have, what you get talking. You don't know what you're having, do you? But
I think the best people to talk to is your GP practice, because they'll be able to tell you what you've had, what you've not had, and what you're due to have. So that they've always got really, really good records. So that's what I would encourage most people to do. So you've got the answer for people. We'll put a little note in the notes that Joe sends out for you.
Yeah, that's good to speak on, isn't it? Yeah, thank you.
I've got a note here, Joe, for enhanced independence. I don't know whether that's purely linked to the Park Homes project, but the single-tier conversation system does drive enhanced independence.
Yeah, that was something that Sarah reported on in her report. I think that was to do with when you're coming out of hospital. I think that might have been part of another report.
Okay, we'll look at that as well then.
I think if we're going to do something on the enhanced independence service, we're probably better off waiting until March, because it's going to be fully implemented from the 1st of November. So let's give it some time to bed in. Okay. We'll be actively monitoring how well it works, and then we can bring something to you that's more meaningful, perhaps in the spring.
Would that be good at the joint meeting or the meeting after that one?
I think it's all part of that system flow bit. So it's crucial to how we enable and support people to come out of hospital. So it will be picked up there, but it might be that Scrutiny wants to have a closer look at it. But I would suggest let's fully implement it and learn how well it's working, and then bring something back.
Yeah, okay, got that noted. Thank you, Chairman.
Would it be worthwhile having a very short presentation on 3-tier conversations?
Sorry, what was that, Chairman?
Would it be worthwhile having a short session on the 3-tier conversation, which would be one of our main drivers to keep people in their own homes instead of being taken to care homes?
We can certainly bring something on that. I touched on it very briefly in the induction session about what we're aspiring to achieve in adult social care in terms of supporting people to live as independent lives as possible, connected to inclusive and supportive communities. So we could do that, absolutely.
We could share that information. I could produce something from the information we have, Sarah, if that helps, and circulate that by email if that is a way around before September.
Yeah, I think it just touched on it, because the document was a summary of what we do in adult social care. The Carol's nodding. I don't know whether we could do a short session on these conversation, because it's fundamentally changed how we deliver adult social care in the county. We've not finished yet, but it's brought about, we think, some really positive cultural changes in the service, and working with people to see what they can do for themselves with support, rather than us just doing an assessment and doing to people. So it's really changed how we deliver adult social care. It's been quite fundamental. So it might be helpful to spend some time on that. Carol, I don't know if you
What do you think, Carol?
I think it's important for committee members to have an understanding about how adult social care was and the key drivers that came out of the Care Act 2014, one of which was the Adult Single Programme, which included this 3-tier model. This is the way we've developed it in Gloucestershire. I mean, it is a very significant cultural change which has been adopted very successfully and needs more tweaking, but we need to move on with it. So I think it's important members know about it. Whether it goes in a briefing or whether it comes in a paper, I'm not so sure.
We could do it at the November meeting if that works with Sarah. We've got sort of a gap there, if that would be something that we could work on for November. Okay, I'll mark that down and I'll circulate the updated plan to everyone for them to note and to see that they're happy with the proposals going forward. Thank you, Chairman.
Okay. 10 to midday. Have we got any more questions or comments to make about the work plan? If not,
I've got hands raised from Kate and from Mark Mackenzie.
Okay, sorry.
Kate, did you want to say anything?
Yes, please. I noted that road safety does come under adult social care and communities, and I can see from Agenda 3 that it was in one of the past papers. Item number 10, page number 10, that there's a road safety cabinet panel report. It's finished, but I'd like to know, obviously as a new member, I'm not entirely sure how all this works. So what's actually going to happen? Because speeding, it's one of the things I get asked about more than anything else, and it's the non-compliance and the non-enforcement. And the report goes into a fair amount of depth, but it really centres, I think, on loss of life or severe injury. It doesn't really talk about quality of life, things like noise pollution, air pollution, and sort of safety risks. So, you know, people aren't necessarily killed on that road because they can't go on it in the first place. You know, you don't walk or cycle on certain places because it's not safe to. And I think it does relate to everything, a lot of what we've talked about today, health, obesity, all those sorts of things come into this. I don't see much about the sort of road user hierarchy that they use in other places, Copenhagen and Holland, etc., where pedestrians are at the top, then cyclists, then motorbikes, then cars, then lorries, in terms of every single new road that is built, all these sorts of things. So I can see there's a report there, but road safety, it's a massive issue for people, walking, cycling, etc., etc. And as I say, people are having trouble crossing roads, they don't feel safe along them, they can't get on the pavements, are overgrown, etc., etc. So as I say, I can see there's a report on there, but what does that mean? What's going to actually happen from that report? And I would like to see road safety very much still on the agenda.
If the chairman allows, I can come in a little bit there. The panel concluded its work, the road safety panel concluded its work last year. That doesn't mean to say the panel can't be brought together again if there are issues or concerns that you feel need to be addressed. My suggestion, unfortunately, Councillor Dave Norman's not here. My suggestion would be that you might want to speak with Councillor Norman. He chaired the panel, and if you feel that there's more work to be done, then that can be put forward, and also a report can be brought back to this committee. So, and that can be included, Mark, am I right, in an update from yourself, from Councillor Norman, at the September meeting, on particularly related to road safety?
Yes, Joe. Can I just check you can hear me okay as well, can you?
Yeah, we can hear you fine.
Thank you, Councillor Hurst. Just to answer the councillor's question, I think in the point you made, which is very relevant, there's three areas really, isn't it? In terms of speed enforcement, that comes under the Office of the Police and Crime Commissioner. In terms of education, that, if you like, is a piece of work that Councillor Norman's leading on with themselves using the facilities we've got at Skill Zone. And then in terms of the environmental impact, that's a piece of work that's led on by Colin Chick. And Councillor Norman has been in discussions only very recently with Chris Nelson, who's now the Police and Crime Commissioner, about re-establishing the road safety partnership and getting on a better footing to make sure there's the interconnection between the council and the Office of the PCC, which had sadly sort of like, I think, faded away over the recent years. So it's now about re-establishing that. But we can bring an update to the September report, as Joe suggests. But it's just so the councillor's assured it's firmly on Councillor Norman's radar and something he's very proactive about.
Thank you.
I've put that down as a note, and I'll liaise with Mark and Councillor Norman to include a good update on the actions from the Cabinet panel. But in the meantime, you know, I'm sure Councillor Dave Norman will be happy to update you on activities as they are at the moment. Thank you.
Then we have Mark.
Mark Mackenzie.
Just wanted to give you an update on the shingles injection. I had mine first thing this morning, and I asked what the why I was there, and apparently it's a one-off injection for anybody who is 70 to 79 years old, and it's your lifetime jab. So it's a matter of, if you haven't been called yet, just ring your surgery and they will clock you in.
Okay, thank you for that, Mark. Thank you.
May I come regarding back the traffic? But thank you for that. I'll pass it on to the chairman, the president's meeting. Regarding, well done for bringing that up, Kate, on the road traffic, because that is a health issue, and it is a health issue. And I nearly went cuckoo last night. These electric scooters, they just seemed, I didn't know you could just park them anywhere. Well, if you're a blind person, I'm a poor bloody guide dog, got to walk around there, they're in the middle of the pavement. It's stressing out for people. And now they're using the road. And I was coming back from, where was I yesterday? I'm everywhere really. I think back from Quedgley way up. And they were on the road, and it is stressful. And I think a lot of them are students, but to just dump them everywhere, I think we really need to get grips with these road scooters. So can they park them everywhere and anywhere? Because the poor disabled people don't know if they're coming and going now, because they can't get off the pavement to get on the onto the road to get back on the pavement in their wheelchairs. I'm a practical talker. Right, where do we go with that, Mark? I know I can't hear half the time.
Was that a question to myself, was it? In terms of...
Yeah.
Happy to take that away, and Joe, if you make a note of that, I'll see which is the relevant council department or office that sits with.
Oh, I've spoken on it on the city council as well, but I didn't know you could plonk them everywhere. What do you do? Run down? We've had them in the cathedral, knocking people over. How do I know that?
Well, there are a number parked outside Shire Hall, about 6.
I think there's new legislation coming out on that one, but again, I'll take that as an action point and work with Mark to see if we can provide an update. But I think the focus, Mark, for the September community safety update is certainly going to be a road safety angle. Is that okay with you, and share that with Councillor Norman?
Yes.
Thank you.
Thank you. Can I go now?
Yes, you can, Pam.
Oh, hang on 1 minute. I've got to speak to Joe. Thanks.
Have we finished with questions and comments? If so, thank you very much for coming this morning. It, as ever, has been a really interesting and progressive meeting. And we hope to get things even smoother for the next meeting and as time goes along. Thank you very much and have a good day.
Yeah, we'll have a good day.
Thank you, Stephen.
Bye. Thank you. Can we stop the recording now, Andrea, please? Thank you, everybody. Thank you for your report, Sarah and Mark.
Joe, that